If you can imagine 2 fully loaded 747s crashing every day, that's how many people die in this country annually. Sepsis is the response that people have throughout the body when infection with germs, viruses, or funguses occur. And depending upon the prior sickness of a patient, the likelihood of dying is very high.
They are very, very sick. Well, always they are on a ventilator. They are not conscious, their families are very concerned, and their likelihood of survival is really held in the balance.
We got to the airport to pick her up. She said, "Boy, I can't catch my breath." And we knew from talking to her while she was in Italy that the family she was staying with had a cold.
And I just remember feeling like after you run for a really long time and you struggle to catch your breath, you feel like that, except for there's something like physically blocking you from taking a deep breath.
We got to the urgent care and I was filling out 2 forms. They came out and told me, we've already called 911 that we're taking her to the hospital. We get to the local hospital. They tell us that her blood oxygen level is way too low. They've put her in ICU.
And about 10 years ago, my colleagues and I began doing some preclinical work with vitamin C. And the work that's been done in this laboratory by Dr. Ramesh Natarajan has shown that vitamin C, when it gets to very high plasma levels, is very potently anti-inflammatory.
So when we started our studies, we worked with a whole range of doses ranging from 50 milligrams to 250 milligrams. But studies done at the NIH in the 2000s showed that you have to give it intravenously for it to act as a drug and not as a vitamin.
Miraculously, they called VCU. They told us that they needed to put her on this special ECMO machine. So then they started putting her on this, the ECMO machine, and then these huge doses of vitamin C. And you literally could see every day her chest x-rays just getting better and better and better. And
vitamin C can improve water clearance from the lungs. It can reduce inflammation by taking away proteins that drive these inflammatory factors in the body when there is sepsis. And it also prevented multiple organ injury in our preclinical models.
Well, I would like to emphasize that we have been working on this for a period of 10 years. And if vitamin C, after a randomized, placebo-controlled, blinded trial turns out to be successful, then this therapy, which will save lives across the world, will have been invented at VCU.
But if we come up with a way of treating a patient, and we have somebody like a Dr. Fowler who can trust you and move that, translate that bench research to a patient, and you actually see it saves patient lives, there is nothing better in research than saving patients' lives.
I think about 2 weeks after or so, I went and got my lungs tested, like how much air they could hold. The pulmonologist said they looked great. There wasn't any scarring that they could see on like x-rays or anything. They looked fine. I think my body knows that like something went on in a hospital, and my brain I don't think can really doesn't want to remember it, but I wanted to meet the people who, saved my life, and it was exciting to meet them.